Thank you, Governor. Good afternoon, everyone. So much of this pandemic has been about what you can't do. And what we're discussing today is an important moment. We've been slowly planting the seeds with you about making that shift from those important restrictions that we had in place to keep everyone protected, to you all now having the tools you need to be personally responsible for yourself and your loved ones in keeping you protected, and allowing us to reopen the economy safely in doing so. So we're finally talking about what you can do if you are fully vaccinated. It's important to understand what fully vaccinated means. Fully vaccinated means that you have received all of the doses of the vaccine that's required for you to be protected, and at least 2 weeks have followed since your last dose. That ensures the full protection that's in place. So I want to talk a little bit about how we arrived here so quickly. The Centers for Disease Control and Prevention have been able to relay some of the very quickly evolving science that led to the confidence that they shared in terms of the shift with our masking. A key for us in Rhode Island is to first take into account what's happening with our data. Our percent positivity has remained below 2% for 10 days. And remember, the lower, the better. Our percent positivity that we're reporting today, of yesterday, is 0.7%. When is the last time that you recall Rhode Island as a state having a percent positivity less than 1? That is tremendous. Similarly, our new hospital admissions and fatality numbers have also decreased dramatically. It's key for us to know that our tools to bring us over the finish line have been working. We've spoken about testing. We want you to keep having access to it as you need it, treatment when it's indicated, and vaccinations. It works. It has been working. We're seeing that in our numbers locally. That gives us the confidence. The other reason is to be able to share with you some of the updates in the data and science that we always base our decision on that have come through. The overall thinking with the data and science is based on a number of national and international studies that have continued to update for us the new information that we're learning about vaccines and its effectiveness. A way that I have thought about it is the vaccines are proving to be so effective that even if you are in a crowded area, indoors, amongst people who are unvaccinated or positive, once you are fully vaccinated, you can rest assured that you have the protection needed to keep you and your loved ones safe. That's a game changer. The first big national and international study update that has been shared is that the vaccines we have are working in the real world scenario. We had high hopes because we knew what the clinical trials data told us. And we've now seen, with hundreds and millions of vaccines, thousands and millions of vaccines given nationally, that clinical trial data has lived up to expectations and has performed exceptionally in real-world settings. Studies from real-world settings around the world, literally numerous countries, show our vaccines to be more than 90% effective in preventing mild and severe disease, in preventing hospitalizations, and in preventing deaths. And as you've heard us say from the beginning, particularly when we were rolling the vaccine campaign out in phase 1, our primary responsibility was to keep people out of the hospital and keep people alive with our vaccination approach. What we've seen even here in Rhode Island is that the breakthrough cases, people who have been fully vaccinated and end up getting infected, is so extremely low, it is less than 1%. It's actually 0.15%. So that means 99.9% of the time, almost, the vaccine works tremendously effectively. That far surpasses what we saw with the clinical trials, and it's amazing when you compare it to what our vaccines usually do. From a public health standpoint, a vaccination tool is powerful. When it works 99.9% of the time, that is amazingly powerful. Our second major update is that the vaccines have proven to be effective against the SARS-CoV-2 variants that are currently circulating both in Rhode Island and in the country. It's important to know that the variants are the predominant form of coronavirus here in Rhode Island. So as I said last week, you cannot rely on natural immunity to be protected. If you've been infected in the past, you likely did not have a variant form. You had one of the older forms of coronavirus. Very quickly over the last few weeks, the predominant form are our variants. So do not just rely on natural immunity or herd immunity to be protected. You as an individual and your loved ones have to be fully vaccinated in order to have the protection. And what we've seen now, it took a while for researchers to be able to say this with such certainty, but we have that confidence now that the vaccines work particularly effectively against the variants. CDC highlighted 2 studies in particular that show that the vaccines work well against the B.1.1.7 and the B.1.5.2.6 variants. Both of those are among the most common variants here in Rhode Island now. That's also tremendous. The third significant update that we have from a data and science standpoint is the research that's showing if you are fully vaccinated, you're a lot less likely to be infected with the virus at all, regardless of your exposures, and therefore you're also less likely to spread the virus to anyone. That's an important science update for us, because if you recall, when we first started vaccinating people, we were very transparent with you about what we knew and what we did not know. We knew that the vaccine would prevent most people from experiencing severe illness and keeping you out of the hospital and keeping you alive. We've been saying from the beginning that it's extremely effective at doing that. We were not as sure about how effective it was at stopping the spread of coronavirus, particularly if you were a person who had asymptomatic infection and unknowingly transmitted it to other people. We now have evidence that suggests that fully vaccinated people are much less likely to have asymptomatic infection, be infected and not know it because they don't have symptoms, and then much less likely to unknowingly spread coronavirus to other people. In addition to, of course, continuing to prevent severe illness, keeping people out of the hospital, and keeping people alive. People who have a condition or who take medication that weakens their immune system will want to talk to their healthcare provider about what is right for them when it comes to mask wearing. We know that these individuals, for sure, we want to be fully vaccinated, but we want them also to have that extra support from their providers about making these very individual decisions. But it's important to know that if you are fully vaccinated, We are saying, based on the science that the CDC has brought to light and has shared, that the vaccine works effectively to protect you and your loved ones. Even if you are in a crowded setting, the understanding is you are protected. Even if you are around people who are COVID positive, once you are fully vaccinated, you are protected. The key here is to get the message to those individuals who are not fully vaccinated, or if you're thinking about it. We are shifting to this personal responsibility and giving you the tools that are needed. The economy is opening back up. If you're fully vaccinated, it's safe to go out. It's safe to really enjoy and have a great summer in Rhode Island. If you're not fully vaccinated, now is the time to get vaccinated because it's not as safe for you. And coronavirus and the variants that are out there are looking for those who are more susceptible because they are not protected and not vaccinated. And so now we can say being fully vaccinated makes a difference. It allows you to feel more comfortable not wearing a mask in these settings and not requiring it, or not social distancing in certain settings. And if you don't have the protection of a vaccine, please encourage your loved ones, your coworkers, people that you worship with, people that you learn with, anyone that you know. Encourage them to go get vaccinated so we can all enjoy together. It's important to know, if you are not fully vaccinated, you've only received one dose or no doses at all, you need to wear your masks indoors, in public settings, and outdoors when you can't keep a distance of at least 3 feet from other people around you. So I mentioned that fully vaccinated people don't have to wear a mask, and that's in most settings now. It's important for you to know what we're saying here in Rhode Island, because there are still some places where masks will be required, even for people who are fully vaccinated. Let me go through those places quickly so we all have a sense together. Please show the graphic that we've made. The places where you would still need to wear a mask, even if you're fully vaccinated, and certainly if you're not fully vaccinated, include schools and child care settings, healthcare settings like hospitals, doctors' offices, and nursing homes. And if you are a home health worker and you're in someone's home, that's at that moment considered a healthcare setting, which means you need to wear a mask there too. Public transportation like planes, RIPTA buses, and trains will continue to require mask wearing. Transportation hubs like airports will continue to require mask wearing. Places that serve people experiencing homelessness will be important to continue to require mask wearing, as well as prisons and correctional facilities. Other places where masks will be required include cities and states outside Rhode Island, where they are continuing to require mask wearing, and in businesses in Rhode Island that require it. Our key here is to support businesses encouraging the reopening of economies, our economy, and people feeling confident to go back out. Businesses can put in place more strict health and safety requirements if they choose. We want to support businesses in doing what they need and help make it known to the public. These are businesses that are following the safe practices and activating the tools that we've provided to be able to cater to you effectively. We're developing signage for business owners to help them communicate to guests about how they are implementing their safe practices, including masking policies. Some places may want to keep masking policies in place. As we move into this new phase, Where some places will have masking requirements and others won't, I want to ask you to remember two things. Number one, don't just ditch your mask. Keep it nearby. If you're in the habit of grabbing your mask on your way out the door, keep doing that. Keep one in your bag, one in the car, one in your pocket. You don't know if a mask will be required in the place where you're headed to, or if you're in a place where you will just feel more comfortable putting a mask on. Keep it nearby. Don't just ditch your mask. The second major thing is if you're in a store or other important business and you get asked to put on a mask, be patient, be tolerant, and be respectful. There is a reason why that business owner has that policy in place. Some people may have special circumstances. There may be individuals who work there who are immunocompromised with something like cancer, and we want to make sure that anyone who comes in the door has that additional layer of protection. Let's support each other as we are reopening our economy and branching out to enjoy Rhode Island this summer. It's going to be an adjustment for us all. This is an adjustment. That is an important one. It's one that we've waited a long time to be able to do. What's key for us is to do it well. We want to stay focused on our public health outcomes, keep our numbers strong the way we have been, and make sure that everyone has access to getting fully vaccinated. You know, and you're going to hear more from Tom, how hard we've worked to operationally ensure that access to getting vaccinated is available to everyone in every zip code possible. If you're someone who might not be ready yet to go grocery shopping or to sit in your cubicle at work without a mask, even if you are fully vaccinated, that's totally fine. I'm keeping mine with me, and sometimes I may prefer to put it on. That person should feel totally empowered to keep wearing their masks if they choose to. And everyone around that person should make sure to respect that decision as well. Rhode Islanders, you all have done an amazing job supporting each other over the last year and a half. And I know that we're going to keep that up together and achieve our goal of enjoying a wonderful summer here in Rhode Island together.